If you've had a stroke, or you're helping somebody who's had a stroke, then tune in. I've got some good updates for you and some great ideas for you to follow along with. This video is not meant to be on its own medical advice. It's meant to be a prompt, a reminder, an add-on, something that you can keep at home, work from at home to supplement the kind of work that you're doing, I hope, with a professional physical therapist, occupational therapist who's helping you and treating you. Today I'm looking at hand therapy, regaining, generally speaking, the finer uses of the hand. This one was suggested to me by one of the viewers who's obviously making some good progress, but wants to be able to get better in the way that they use their hand. As ever, I will refer to the more obviously affected hand and the less obviously affected. Stroke affects both sides of your body. The stroke happens in one side of the brain. It can be the blockage type or it can be the bleed, but it affects both sides of the body. One side of the body is usually affected in what you might describe as blindingly obvious ways. The other side is just affected in subtle ways. There are problems with timing, grading the level of effort, grading the power used, grading the sharing, coordination. We usually do well with our fingers and hands on the working side after stroke. These are in use a lot and they're reused from day one. But there will be problems with coordination, particularly around the shoulder, the way the shoulder interacts with neck and the rest of the spine, the way the shoulder interacts with hips and pelvis. Working on hands, the best approach is, to my way of thinking, what we can call a meaningful approach to therapy. It's sometimes known as functional, which is a bit of an odd word. It's not one that we would generally use very much in day-to-day language. So I like the word meaningful. And when we're coming to designing programs for hand therapy, the idea is to use meaningful objects. Now, perhaps the first one is the humble ball. And I'm often asked, is it okay to use a ball to help strengthen my fingers? Well, some people might be able to do some squeezing type exercises with a ball. Certainly in the UK, this idea was poo-pooed for a long time. Don't put objects in the hand. It'll make the over-tightening, the spasticity in a hand worse. That is not necessarily true. It might do to a small number of people. There are some people who have an unusual, uncontrolled reflex in the palm of the hand and fingers. When you put an object in there, it makes the over-tightening of the hand worse. In which case, you would be wise to do something else before you use objects in the palm of the hand. In other words, you would desensitize, reduce the sensitivity of that unwanted reflex in the palm of the hand, which, as previously mentioned in other videos, you might do with things like TENS machines. You might use pressure garments, you might use soft tissue, massage type of techniques. So there's a range of things that you might do before beginning functional or meaningful exercises with objects. But our hands are made for objects. While I've got the ball, the number one object that we would want to have in our hand is a piece of food. So let's pretend this is a green apple. And yes, we want to hold the object. We want to be able to pick it up, pick up an apple. very importantly, we want to be able to turn it towards the mouth. So you could say that this movement is a movement of the forearm that moves the hand. And then to be able to bring the food to the mouth and assume that we can time the opening of the mouth, the preparation of the jaw and the tongue. There's a whole range of things that do happen in order to allow us to eat. And then bringing the food to the mouth. So this is a very meaningful object. And if you're just using a ball, I encourage people not only to do the mechanical exercises with the ball, trying to grip it, trying to let it go. Not only that, but also to extend the meaningfulness of that exercise by imagining that it's food. And, of course, where possible, get rid of the object and actually use food. If you perform a movement with food, successfully get some food, your brain will love it and will do its utmost to, you can call it heal if you like. The fancy word that is used, you may have heard of it now, is that it will adapt plastically. Neuroplasticity begins to happen if you stimulate your brain in really good, useful, exciting ways. So using objects is definitely a really good way forward. Before going a lot further, let's have a little think about our own anatomy. So looking at my hand, you'll see it's coated in skin. I'm just going to put a glove on for a moment. Another layer. Because our anatomy, our body structure is made in layers, a bit like an onion. So I've just added another layer to my hand. And I've got a layer of skin. Underneath the skin is a layer a bit like this, a glove of, you can call it gristle, if you like. There's little bits of fat and things like that. Not an awful lot around the hands, but there's a little bit there, and layers of muscle, gristle, and underneath there are more layers of tendons which have layers around them to lubricate, or sheaths, they're often called, tendon sheaths. So the whole thing's built in layers like an onion. And the key thing about the hand is the layer of gristle that's shaped like the glove underneath the skin is an anchor for, amongst other things, an anchor for muscles that are much further up the system. So let's be clear. Any muscles up in the shoulder here, they have their separate names, but believe you me, they attach to your hand. Strands of them do, coming down to the layers of gristle in hand and forearm, the way that strings come down from a parachute, attaching to points quite far away. But that's enough anatomy for now. We started with one kind of a ball. Where possible, do use different varieties and textures. This one's a little bit more squishy, so it will produce some resistance, but through a range, so the joints move when it's squashed, and that's important. Movements through a range will send different signals back to mission control about what just happened. The next thing to remember is if you're doing exercises, let's say you're far enough on that you can do some exercises like this, squeezing a ball and letting it go. Well, in my view, it's a pretty neat idea to do some with the most obviously affected hand and the less obviously affected hand, and the more obviously affected hand and the less. Why would we do that? Well, we would do that because in your brain, they're part of the same system. If you do something with one hand, your brain will try to teach your other hand to do it. And it's not obvious to see this happening if you've got quite marked problems with your hand. But it will happen. It's just that it doesn't happen over a space of minutes. It happens over the space of months and years even. But it's worth doing work with both hands. Good. Then working with objects, we can start to think of a range of them that work in different ways. So, on the subject of a ball, now I've got a much larger one. I can begin to use that with some help. Maybe I need help to get on the top of it. And I can begin to use it to really shape my wrist. So most movements in the fingers don't happen here, but they do happen when the wrist is, the posh word for this is in extension, the position of extension of the wrist. If that is flexion, that's extension, okay? So using this to help the shaping of not just fingers, but also wrist, and we can also use it to help with other exercises that start to involve hand and shoulder. I can hold this on here and I can take it all the way over there, which is doing what? Well, one of the things it's doing is beginning to turn my hand palm upwards, which I need for feeding. So using balls to help us produce movement and improve the feedback system. We're all keen on output when it comes to hand therapy, but we must remember the feedback too. Muscles, joints, everything sends messages back to mission control about what just happened. Lots of other stuff happens too in the brain. And we're only just beginning to understand some of that, I can tell you. So lots of different sizes, lots of different textures. And then we move on to other things that might be meaningful. I live in Britain, so I'm blessed with having a car. Mixed blessing sometimes. These are very familiar to most people in Britain. Bunch of keys. So here we've got a car key and a couple of keys for the house. And we'd be familiar with that. You may not live in a region or country where that's the norm. So if that's the case, and these aren't meaningful to you, then they're much less use to your brain. So choose wisely when it comes to picking objects to work with. After that, we've got a whole range of objects which have, in my heart, a special place. And these are objects which interact with our bodies. When we move a hand, of course that's lovely. But when it acts with another part of our body, or an object that interacts with our body, then our brains get particularly interested in what's going on. So here's a simple everyday object, a toothbrush. Hopefully most of the people that are watching this, if you've got the gadgetry to watch this, you brush your teeth. So an object so small, you might need a lot of help to get it there. You might need to use things two-handed, starting to try to clean teeth like this. It's slow and laborious. but may well be worth taking the time because it means such a lot and is so interesting to the movement areas of your brain. Hairbrush, again, here's an object, slightly different shape, and can be used two-handed like so. At first, it can be used two-handed. Then gradually, maybe supported, can begin to interact with other parts of our body, beginning to use objects like that to help with meaningful things. Grooming. It's a great area to work on. Many of the people watching this, if you've had the stroke yourself, the chances are that you're older and may well be using glasses. So here's an ordinary glasses case. This is another great example of an object that we interact with daily. It's very meaningful to us. And even more meaningful will be the glasses inside. These are ordinary readers. Beginning to use these carefully. So ordinarily, in my day-to-day, if I put on glasses, I do it one-handed. I'll use this hand as it happens. But it would equally be okay, I'm leaning on the table, to be trying to do things like that if you're a little bit further on. So glasses and glasses case, lots of little small areas, little subsections of activity that you can do with objects like that. Here's one that everybody should be familiar with. It's an ordinary drinking cup. One of my little favourites. It's got Eeyore on it, who sounds a bit dull, just as I do when I'm on camera. But Eeyore was always worth listening to. He had wisdom. There are lots of ways and lots of different grips that you could use and work on, and different shapes that you can work on with a simple object like a cup. So you can hold it like this, or you might be used to holding it with a thumb through the handle and the hand around. You might hold it this way, you might hold it this way. So try to remember what you did, and if you're not sure, try it with the hand that you didn't used to use, because your working hand, your more obviously working hand, will have memories of what your stroke affected hand used to do. A simple point to touch on: when you first start using drinks, I encourage people to use a plastic cup as you're beginning to work on things. It doesn't matter if you drop a plastic one, not so good if it's a china or glass. So just little points like that just to remember, and you can begin with an empty one. You can start adding meaning to it in the way of something to actually drink, which will reward your brain, as well as the idea that it also adds weight to it, so it adds some resistance. So different materials are very useful too. So those are things that interact with our body. And then here is one, the television remote, which interacts with our brain. Here's a little fun idea. So what's a television? Well, a television is really, to me at least, it's not an object. It's something that is on to entertain, to switch off to. It means I don't have to think. And the remote control is the entry into that world. Now in my house, I don't get to use this. I have a special person who looks after it and operates it. But if you're familiar with using a television remote, then that's a meaningful object to start to interact with. So can you put the object in your hand at all? Will it get in there? Depends how much your hand is affected, how much it's not working. Can you get it into the hand at all? Usually with a thumb, can you get the hand from one side to help the other one place onto the different keys that you might use? Up, down, left, right, select, menu, things like that. And if you can get to using things like that, that's very, very meaningful. If you want to improve that and you're working at a very high level, still remember, have a go with your affected hand, have a go with your inverted commas, unaffected hand too. Both hands will have some memory of where the keys were, how much pressure to use, whole range of things, how to point it. So do use these if they're functional objects or meaningful objects to you. One of the things that I wanted to do was to introduce for hand therapy the idea of the mirror box. Now you can buy special equipment for doing mirror box hand therapy. You don't have to restrict using mirrors to helping with hands. You can use them on feet, legs, knees. You may need a different size of mirror. You might need a long, thin one. You might need somebody to help hold it for you or position it. Here's an ordinary tabletop mirror. It just tilts a little bit on its frame. And here's the magic. When you work with one of these, you'll have it facing in towards you. But for the camera, this is what I wanted to show. This is my left hand. When I put the mirror in a certain space, the camera can see this. I can't see it from where I'm looking. The camera can see that now there are two hands in the picture. So if I do something with my active hand, it gives me a mirror image. This is my left hand. In the mirror, I've got what looks like my right hand, and it's working normally. Ooh. My thinking head, my intellect, such as it is, knows that this is a trick. But there are parts of my brain that do not know. There are parts of my brain that just do. And that is the movement part, amongst other things. Hopefully also parts of my brain that look after my heartbeat and my breathing and a range of other things there. They don't know much, they just do for me, automatically. So when I do this to my intellect, it's a trick. My two hands are not working, it's only one. Now, with a mirror, if I take my non-working hand and maneuver it into a place behind the mirror, now my non-working hand is in the same place that the mirror image is living. Maybe I'm overcomplicating this, but just know this. When you start using mirrors for movement training and pain relief, over time, it's a little bit of magic for some people. Some more than others, of course. Every treatment, whether it's an aspirin or an exercise or listening to music or watching a film, all of the different things that we do have different effects on different individuals. But it is worth having a go, and for most people this is either free to have a go at or very affordable. So do use Mirabox. Now, if I turn it so that I can see my reflection, I'm looking at my left hand moving, and in the reflection there, it's what looks like my right hand. And now I can begin to put my actual physical right hand into the same place. And I tell you, I've had no brain injuries and no strokes, but when I start doing things like that, it's quite a strange experience. And now, if you notice, I just dropped my actual right hand out of the space occupied by my reflection. So I'm trying to experience the strange things that happen in people's brains who've actually had a stroke. People have told me about this and the funny sensations. This is just me having a go. Can I experience something like it? If I can experience something like it, then maybe I can understand you and your difficulties just a bit better. Maybe. So here we go. These are things that you can start to play with Mirabox therapy. You don't need the fancy purpose-made equipment. You can use an ordinary mirror and it's just fine. If you do have resources, the pre-made boxes are very good, and if you've got a few extra dollars, a few extra pounds, and you want to buy those sorts of things, fine. But you can make do with an ordinary mirror. Those are some straightforward, everyday, usable ideas that you can use for hand therapy. A couple of things still worth remembering about another video that I made, which I talked about the position of safety. If you think that some of this work is too difficult for you and is far on, there's still some preparation that you can be doing. And that's to say, making sure that your hand does a couple of particular things. Your finger joints must go completely straight. The main knuckle of the hand must be able to do one right angle. The thumb must be able to separate fully from the rest of the hand. If these stretch positions aren't achievable, then you're going to get a very stiff hand over time. Most of the splints that are issued, certainly in UK hospitals, actually leave the hand in a very mixed position, and if allowed to stay like that, the hand will end up stiff and nigh on unusable. So still making sure that these joints straighten properly and that these ones bend properly. The last point to make about hand therapy is around pain. If you're still getting pain in your hand, then it's a really good idea to do something to get rid of that pain. I think that 9 out of 10 people that I go to tell me that they've got no pain. But when we start to stretch muscles and joints, whether it's in the hand or forearm, or maybe up in the shoulder, then they say, oh yeah, I've got pain. And in fact, most people after stroke do have pain, part of the reason for slowing or stopping recovery is because your body is doing its darndest to avoid pain. It always will. I liken it to if I have a drawing pin sticking through the sole of my shoe. If I try to walk on that, my body will not let me. It makes me go on my tiptoes until, if I'm wise, I take the pin out and take away the pain. If you don't take away the pain, then your body simply will not play. I'll leave you with that thought. If you've enjoyed the video and found something useful in it, please do like and subscribe. Hit the alarm bell button so that you get a little note when the next video turns up. I'm going to try to do these about once or twice a week. If you've got any good suggestions or good questions about your recovery and you want to put them in the comments, I will do my best while the channel is small to make films, put up information that relates directly to it. One thing that some people have started to do is put up short videos of their own recovery so that they can ask a question about how to deal with a particular problem. If I can get that kind of information from somebody individually, what it means is that I can begin to offer actual advice. If I can really see what's happening and really know what the problem is, then I can have what in the UK we call a duty of care, which means to say that I can offer individual medical, if you like to call it that, advice. Thanks for watching.